Welcome, welcome. Welcome to your family mental health wellness, brought to you by the Institute for Marriage and Family Affairs. Welcome, welcome. Thank you for joining us. We're going to be starting in earnest. Okay, welcome. Let me get off the music. Welcome to your family's mental health wellness. I'm sorry. This morning we're going to talk about depression. We choose topics that we see daily in our practice. My wife is a nurse practitioner, so she does prescribe a lot of medication. So same thing with me. I work in a psychiatric hospital. I have a private practice. So these are topics that we are seeing. These are subjects and diagnoses that we are seeing people in practice, in prescription, in the hospital, our friends. Depression is front and back of mental illness right now. The second one, obviously, is anxiety. And those two are also symptoms of other diagnoses and disorders. So today we are going to talk about the symptoms. We're not going to talk about it clinically because I realize most of us are not that clinical. We're going to talk about the big five symptoms, and then break it down. Why are we talking about depression? Again, we see it daily. And secondly, it runs across other mental health illnesses and diagnoses. So there are tinges of depression and anxiety, tinge of it in schizophrenia, tinge of it in bipolar. Almost all of them have a path of those symptoms that mimic each other. So we are going to talk about what we see. What are those five other things that you notice? Remember, my topic is symptoms and signs. Signs are what you see, you, the observer, what you're going to see the patient do. The symptoms are what the patient is going to feel and do. So it's dual. The big five symptoms would be isolation. Isolation. Suddenly, the person will not feel like doing anything. They want their comfort zone. Even when the person, a child, a spouse is in a family or live in a communal place, they want to be in their room. Even when they are sharing rooms with people, they want to be on their bed or in the couch, not even watching TV, just in that zone. So isolation is a big one, a big sign and symptom of depression. I was just talking to one of my clients yesterday, and he said for a whole month, he did not leave his house. He lives alone in an apartment. He said for a whole month, 30 days, he did not cross his door. His door did not open. He has a caseworker. He said his caseworker brought him food on the first of that month, brought him groceries. Everything he needed was brought to him, placed in the front pouch. He went out, grabbed it, came inside, and that was it. He did not feel like calling anybody. He did not feel like going anywhere, no exercise. He said all he did was sleep, drink, and just moan around, nothing. So isolation is one big one that you're going to see. The second one is feeling of worthless. They feel less valued. Not that you're not valuing them, that they are not worthy. There's that feeling of not being important, not being valuable, not being useful, not being successful, not being anything worthy. And this feeling is what eventually leads to suicidality or suicidal ideation. And if that's not what, obviously to attempt and maybe success of it. Next week, we're going to talk about suicide. But today we are focusing on depression. So a feeling of worthlessness. You're looking at the person, they're a high achiever, they've been on the road, suddenly the person still starts feeling like they are nobody. They haven't achieved. All the focus is on the negative. I have a 22-year-old young woman now, medical student, high achiever in one of the Ivy League schools, good school, doing very well until 4 months ago. 4 months ago, she started having depression. And since that time, she feels worthless. All her focus is on the negatives, the things she's not, the things she couldn't achieve, his classmates that have done better than her, that's the focus, overwhelming focus on the negatives, the mistakes, the flaws, the things that are not working for her. 22-year-old medical student, you would say she has it all going on, but no, she is focused on the negative, so much so that this week we are having sessions daily. Her parents are paying for her to talk to me every day for an hour because she has tests coming up next week. She has no energy. She doesn't feel like doing anything. They are fearing more consequences. So she's talking to me so that she can keep going and take her test. So feeling of worthlessness and hopelessness and helplessness, there's really nothing I can do about this. That's part of it. The next big one is lack of appetite. Not feeling like eating. Basically, you have to force them to eat. Remember the person that I talked about that was in the house for a month? He said he did not eat. All he did was drink alcohol, take a few snacks, and just moan around. He said he did not have energy to even watch TV or play a video game, which is what he normally does. So for a whole month, he was on his bed, to the kitchen to grab snacks, drink alcohol. So he said one time his alcohol ran off and he called them to bring, he ordered alcohol, they delivered it on his door. That was the only time he opened his door. He just opened it, stretched his hand, grabbed the package inside. That's it for a whole month. So you would have lack of appetite. They don't feel like eating. The next one would be lack of sleep problem. Either you sleep too much, you're not getting enough of sleep, or you are sleeping constantly, or you are not sleeping at all. You sleep a little bit and then you wake up, can't go to bed, or you have difficulty even sleeping. They stay awake till late, trying to sleep, can't sleep, turning and tossing, and they're just lying down. And then the fifth one, I think the fifth one is lack of fatigue, or have feeling of fatigue. Remember, first one, isolation. Second one, feeling worthless. Third one, lack of appetite. Fourth one, lack of sleep. And then the final one, have feeling fatigue, tired, low energy. The 22 years old that I'm dealing with sat in the couch for more than 5 hours. She told me, she said, I was sitting in the couch in my room for 5 hours. I was feeling like getting up and going to do something, but I didn't have the energy. The couch seemed so comfortable, felt so comfortable that I did not want to do any other thing because I had no energy. And that lack of energy is also lack of motivation to do anything. Tiredness, lack of energy, sometimes fatigue, extreme fatigue, lack of energy, not motivated to do anything. And finally, this is not part of the numbers that I gave you. Number 6 would be not finding pleasure in the things that you normally enjoy. This, my client, is a social media freak, has a lot of friends, very extroverted. She talks a lot. She's very friendly, but suddenly she doesn't feel like doing any of those things. Her friends will call, she'll see their phone, their number coming in, people she normally would jump on the phone and chat with. No energy, no pleasure, doesn't find any, don't feel like talking to them. So those are the signs and symptoms of depression. At the end of this, I'm going to take some questions, but let's begin to break them down. How do I, as a professional, because if you ask your client, what are you feeling? They are not going to be able to say isolation, not eating well, lack of interest in things I enjoyed before, having sleep problems. They may say sleep problem because that hits them. They're not going to give you this if you're a professional in clinical terms. They are going to maybe tell you one of them and not all. So you as a professional, you as a parent, you as a school proprietor that is wanting to know what's going on with your students, you as a caregiver, you have to probe and ask questions along this line. You have to use your observation. When my clients come, when they come to the hospital or when I have the first session with them, I want to talk to their family members. What am I looking for? I'm looking to find out what my client doesn't know or what they don't remember. We call it collateral. You hear me talk about collateral a lot in a lot of our sessions. It's important that when we do diagnosis, we talk to the family members. There's something the Igbos, my tribe, said, that said, if you want to know what's happening in the rabbit's den, if you're so curious and you're wanting to know what's going on, what do the rabbits do when they go inside their den? Do they watch TV? Do they sit in their living room and kind of talk? What do they do? If you're so curious to know what they do, ask Mr. Rabbit. Say, hey, Mr. Rabbit, I'm wondering, when you all go inside that den, your rabbit den, what do you all do all night long? This rabbit will tell you. So why am I saying this? If you want to know what is going on with your client, ask the family members, ask the friend, ask the roommate, ask people who see your client every day. They will be able to tell you more than your client will tell you. First of all, if your client, most clients will come to you when they're in and out, when they are out of it, mostly out. So they're not in the right frame of mind to remember those things. And that leads me to one story. I had a client who was admitted in the hospital, Was firefighter in his 40s, very high achiever, doing well. That's his first mental health crisis. So the second day after he came, first day they usually will sleep and they are angry at something, either angry at family members that brought them, angry at themselves for coming, angry at the police that brought, whatever brought them to the hospital, they are angry for the first day. Then the second day, they are pacing around, they're wanting to know, when am I getting out of here? Now they are thinking about things they are missing. So second day, he came to me and said, hey, Mr. Victor, I want to know, when am I leaving here? When nothing wrong happening, you can see I'm well okay, I'm doing well. When am I leaving here? Why do I need to be here? Because they are comparing themselves with other patients who may be worse off, who may be acting up, pacing around, doing those things. And they are seeing they are not doing any of those things. So I said, I don't know. Perhaps we need to talk to your wife and see what she thinks. So we get on the phone, we're talking to the wife is on the phone, my client is here, my patient is here. I asked the wife, I said, tell me what brought your husband? What made you bring your husband to the hospital? And then the wife starts talking about how the husband is talking to himself, how the husband is pacing around all night long, how the husband hasn't eaten for 2 days, how the husband basically goes to work, comes back, goes to room, does not do any of the things he used to do. And for the first time, it dawned on my patient that he has a problem. Because according to him, he thought that all those times he was talking to himself, he was praying. He said, I thought I was praying. I thought I was communicating with God. I didn't think that was a problem. And then the wife said, yeah, sometimes you pray, but most of the time you just talk to yourself. You talk to yourself for hours. And after that meeting, my client said, Mr. Victor, whatever you want to do, whenever you want me to leave, I'm cool with it. I have a problem. I have a family that I need to take care of. I gotta be well. So getting collateral from your family members, from those that see the client, is very critical to getting a full assessment of what's going on. Ask their roommate, ask their friends, what do you observe? What do you see? How does this person act? When they talk to themselves, what are they saying? And then you ask your client, when they hear voices, what are they hearing? What are you seeing? Those things formulate your assessment, and your diagnosis will help you to do your diagnosis and obviously treatment plan. So what do I do? As we go with time, I give them a form, and this form can give you this. And this form basically lists all the possibilities. And I ask them to assign a number to the form. I'll just read some of the things they have to do. Trouble sleeping. Remember, I'm not saying, are you sleeping too much or are you not sleeping too much? I'm saying, do you have problems sleeping? General problem. Frequency, 2 is occasionally, and then I'll say check wherever you have problem. Problem sleeping, are you unhappy? Check. Do you constantly feel sad? Check. Have you lost significant weight recently? Because when you're not eating well, because of loss of appetite, you're going to lose weight. And some people will eat more, so they're going to gain weight. Has there been any change in your weight in the last few months? Check. Have you done things that you don't normally do? Have you been talking about end time, giving out your stuff? Check. Have you been consuming more alcohol or drug than you normally would? Check. Are you feeling like you're not worthy? Are you feeling worthless? 90% of them would say, yes, absolutely. That's one core symptom of depression, feeling worthless, helpless, and hopeless. Those 3 things, all in one leads to the other. You feel hopeless, you feel worthless. You feel worthless, you feel hopeless. And feeling helpless, meaning it's a dead end, can't help myself. This is where I have ended up. That becomes a problem. Feeling withdrawing from friends. Are you interacting with your friends, or have you been talking to your friends lately? The person 9 out of 10 times will say, no, I don't have the energy. I haven't talked to my friends. I don't feel like talking to them. Feeling helpless. I've talked about that. Constantly bored, meaning you're bored because you don't have the energy to do anything. You're bored because the things you normally would find pleasure in does not give you pleasure anymore. TV will be in front of them. Somebody does say TV freak. Suddenly there's no program that interests them. TV will be there, but they would rather not watch. For children who are in school, they're gonna be skipping school. They're going to, if they can. If they cannot, you're a parent, they're gonna be asking you, Mom, could I not go to school today? They want to be excused from school. Can I just rest today? I'm tired. You're going to hear those things. Are they having fear of death? Are you afraid of death? Suddenly, are you thinking about dying? Are you irritable? That's one of the things. Because of all these things, the person is not going to be happy. One thing that I say is, if you don't think right, you're not going to feel right. You're not going to act right. If you're feeling sad, if you're feeling worthless, you're going to feel sad. It's not a good thing. You're going to also be irritable. If people are trying to push you outside that zone or to do things that you don't want to do, you're going to be irritable. No interest in activities that used to give you pleasure, excessive drinking, trouble focusing. Trouble. Are you having problems focusing? Remember my client, the 22-year-old medical student. That's one of the reasons why the parents hired me. She can't study. She has problems focusing. She cannot study. She reads one paragraph. She has to come back and read it again. And this is a medical student. So this is a type A achieving child. And suddenly she can't study. So we're working on that. Our test is coming on Sunday, on Friday, and then Wednesday. So far, so good. And then they feel overwhelmed because you're sitting down, you don't have energy, you have so much to do, you feel overwhelmed. The reaction is not to do anything, just don't want to know where to do. So part of what therapy that I'm giving her is we're looking at her body of work that she needs to do. We're breaking it down. Helping her to see the little, to divide the work between the days, the test, and all those things, and giving her things that would motivate her. Study a little bit, 30 minutes, get up, take a walk, go outside, get fresh air, play with your dog, call your friend, talk to your mom, whoever, whatever you enjoy doing. For 10 minutes, 5 minutes, study again. And then we will increase. Those are the prescription or the treatment plan that I'm giving her. Unexplained aches and pain. Suddenly you have aches and pain. You're going to ask them, do you have aches and pain? Check. Are you feeling more angry? Check. Difficulty making decision. See, these things are connected with each other. If you have problem concentrating and focusing, you're going to have problem making decision, because decision is looking at the whole picture and saying, okay, should I go left? Should I go right? The right decision is that you've looked at the situation objectively, all of it. If you look at half of it, you're going to make wrong decision. All of you have to have a full perception and picture of what you're looking at before you make a decision. A negative attitude, obviously, which comes from sadness. One other one, have you been crying frequently? Have you been crying lately more than you normally do? So those questions will be, so crying will be a sign. And then half of my clients will say, yes, I found myself crying for nothing. I can't even explain why I'm crying, but I cry. It comes from sadness and all that. A strong feeling of guilt. Like a young girl has it. She feels she's a burden to her parents. And that adds to it. I feel like I'm a burden. My parents have done so much to me. For me, they're paying my school fees, they're taking care of me. I feel like what I'm doing by being sick, I'm adding to their problem instead of being a blessing. So that feeling is there. Obviously, we had to process it, feeling like a failure. Actually, this all started because she had a B in a class and she was aiming to have an A because of where she wants to do residency. And then she has a B. Because of that, she now feels like she's a failure. She didn't make A. She's an A student. So we had to process that. Suicidal thoughts. I did say that depression is one of the things that leads to suicidal thoughts and ideation. So have you been thinking about dying? Have you been thinking about that if you're no longer here, it probably will be better? Disappointment in yourself. Have you been feeling disappointed that you're not reaching your potential? You're not achieving your goal. You're not following your plan. Forgetfulness will be one. Some people, not all, experience forgetfulness. Conflict with family, friends, and co-workers. Because of the irritability, some people are going to misunderstand that this person is going through stuff and give them their space. And this will lead to conflict with family members. For instance, it may be someone who is usually outside who participates in the chores in the house. Maybe they do the dishes. It's a child that goes to school, comes back, does their homework and does dishes or does chores in the house and then retire. And suddenly they come back from school straight to the room, not doing their homework, not doing the chores, and not even remembering that they were supposed to do the chores. You ask the child, why didn't you do the dishes today? And they scratch their head and say, I forgot. And you're wondering, you've been doing this forever. Why would you forget? That's a sign. That may be a sign of depression. Lack of interest in personal hygiene. This is a big one. For most of us, we take showers, but for these people, we have people in the hospital that we have to force, basically persuade, encourage, twitch, push, motivate to go take a shower. Before they came to hospital, especially those that live alone, some of them haven't taken a shower for 3 days. No energy, nothing, no motivation to do any of those things. So the hygiene level will drop down a whole lot. So we're going to have to pick it up. So has your hygiene been poor? They're not going to make up, especially those who live by themselves. Those who live with people might go take a shower because they're living with people and they're feeling a little bit of shame. But those who are alone, just yesterday, one of my clients was talking about the pile of clothes in her apartment. She said, I haven't washed my clothes for the last 1 month. So I've just been piling them. And one time I ran out just to go to work. I went to the store and bought some more. So she has not done any of that. So the hygiene level would obviously go down. Not just hygiene, just look. The person used to be prime and proper. Suddenly you see them coming, hair is not cut. They used to make up. Suddenly they're not making up as they used to. Hair is always braided, always made. Looking prime and proper. Sometimes they come to work with the same clothes they wore yesterday because the interest is not there. Constant restlessness. These are all signs and symptoms that when we find them out, it raises alarm. Now, signs and symptoms, what do? They tell you something is going on. They really don't tell you what's going on. They don't tell you exactly this is depression. Absolutely. So you are not a psychiatrist. These are signs to observe and seek medical help. Go to a psychiatrist, get proper diagnosis, and then come back, get proper medication, and then deal with it. So why are these important? If we can, I tell my clients who end up in hospital, if you can catch these things early, we avoid being hospitalized. We avoid going into crisis. We avoid it deteriorating because we see the signs. We see someone who used to be out all the time, suddenly indoors, isolated, not calling, not doing anything. Those are time to say, perhaps we need to go see a doctor and see if something is going on. And for those who are already on medication, just because you're taking medicine that is working for you now, that doesn't mean it's going to work forever or it's going to work all the time. You may have been given a dosage that matched your stress level last year. Today, your stress level has gone up because you are experiencing some difficult time. The doctor may need to increase your dosage or decrease it or do something. I'll give you something different. So just because you're taking your medication doesn't mean you won't feel any of this. My 22-year-old client was on medication. Actually, she went back to the doctor. The doctor gave her a new medication, and that made her worse. That's how I got back involved weekly. I was seeing her once a month, but I got involved daily because she's dealing with her medication. It's not working. She's going through the adjustment period, and she has a stress level that is up in the roof because she has 2 tests that is coming on. She's already not doing well in the other test. So a lot of things going on. So we have to address her situation from the medical perspective, meaning see a psychiatrist, get prescription, and then do daily therapy. This is the first time I'm doing daily therapy, and I was hesitant to offer that. But the dad said, my daughter has 2 exams coming. You seem to be the only one that she listens to. I don't mind paying. Can you see my daughter every day? I said, why not? If your daughter wants to see me every day, we can talk. So I asked my client, which is a young lady, I asked her, do you think you have time for us to meet 45 minutes, 1 hour daily? She said, yes, Mr. Victor, I think I need it. I think I need it. So dad wants to pay, client wants to see me, I'm available, why not? So far, this is our 4th day, and it's helping her. She has the test tomorrow. We talked yesterday, and she's in a good spirit. So it's working. So you have to look at it from this perspective. Fellas, we are almost done. I want to talk to you. Remember what I said, that these are signs. It's telling us what's going on or what might be going on. It doesn't conclude it. You need to see a psychiatrist. If you need to know more, 30 minutes every day or every week, it's not enough. If you have a family member who is struggling from mental health, if you have any of these things, anxiety, or you have any kind of mental health, or if you are a practitioner like me who sees a lot, if you are a parent that have children, if you are a school proprietor, if you are retiring like me, I'm in my late 50s, I actually got into this profession because I felt, my wife and I felt that this would be a good thing to retire into. We enjoy doing it anyway, so why not? We have a program, the Certified Mental Health and Addiction Counseling Program. It's a 14-week program. It's actually, the content is the same content that they offer for licensing of licensed chemical dependency counselors in the state of Texas. That's the same curriculum that we are teaching. That program is 6 months. That program runs from $5,000 to $15,000, depending on which school. But we are offering it for PTs because we pride ourselves in being at the forefront of developing psychotherapy in where those things are not. So I encourage you, think about registering for CMAC. That's what we call it, the Certified Mental Health and Addiction counseling program. It's coming up in January, but we are registering now. Now we are offering discount, 20% discount for those who register before January. So think about it. If you're retiring and you're thinking about a career to retire to, if you're a pastor, you have congregations, if you're an NGO leader, you are the owner of an NGO, if you're a school proprietor, if you are a counselor, a therapist like me, these are skills that you must have. Get a full dosage of it, get all the things that you need to counsel drug addicts and those who are dealing with mental health. If you're interested, say I'm interested. If you're on Facebook, reach out to us by email, info@timfa.org. Info, I-N-F-O, at T-I-M for mango, A-N-F-A, timfa.org. Or reach out to us here and one of our staffs will follow up with you. Thank you. I would end the broadcast now, but I'm going to hang around for those who are on Zoom. If you have any question, today I have a little bit of time. I will answer your question. I'll take 2 questions today. Thank you. Questions, and thank you all for coming. Thank you for joining. So we are off the air now. We are off. We're still recording, but we are off the air. Our recording has stopped too. So if you have any question, I will take it now. Any question?